Now, even as we count down to Christmas and many Kenyans embrace the festive season, a group of people in Kisii will be spending yet another Christmas away from their families. About 26 people are still at the Kisii hospital despite being discharged after recovery from mental illnesses. KTN's Fred Moturi reports.
As with any such health institution, this mental unit is not without its share of patients being abandoned. The Kisii Teaching and Referral Hospital has for years been home to abandoned patients, some people who no longer need to be here. According to hospital records, there are sometimes up to 50 patients in this unit that has a capacity of only 20 beds. Currently, there are at least 26 abandoned patients here. The facility introduced the option of open wards, where family members are allowed to stay with their sick relatives. Some family members stay for only a few days and then vanish.
I have on a larger picture, mental illness has not been fully accepted in Kisii community. It is highly stigmatized. A lot of people who have relatives who are having mental breakdown, they want to believe that it is witchcraft.
Bound by their Hippocratic oath, the doctors cannot evict the patients.
Papa yangu alikufa 1996. Pia my mom alikufa 1993. Wote walikufa sina wazazi. Sasa nakwanga tu hapa hospitali tu nakwanga wanakucha my aunties, wananiona kidogo, my uncles wananiona wanatoroka. Mimi nashindwa sasa maisha gani nitakaa katika hii ward.
The community regards the mentally challenged people as a bad omen. This compounds the challenge of integrating them back into society.
So you find those who recover, who need to join their family members at home, are left with us, where relatives want even to disown that those are not their kin.
Kulikuwa na mwanadada alikuwa Kisii, akakuwa mgonjwa na hiyo shida ya mental, akakuwa kwa ward karibu mwaka mzima. Bwanake alimutoroka, akamleta hospitali, akamwacha huko, ikanibidi nikamchukua mpaka kwao.
In special circumstances, the hospital has waived charges for some of these patients. It, however, requires the involvement of the provincial administration. This has, however, also raised other issues.
The ladies usually they walk around, they are never accepted, so they get unnecessary pregnancies and they get babies who don't have care themselves. They have nobody to care for them, and they create more problems.
Most of those who are discharged seldom return for follow-up medical visits.
Because they are not accepted, they are never followed for clinic, because we usually give them follow-ups. Some don't even get a fund of coming to the clinic to visit the hospital as it is indicated.
George Mugo, a project coordinator with the Social Life organization that majors in community psychiatry, said that his organization has offered to pay the National Hospital Insurance for all the mentally challenged individuals here.
I'm supporting them to pay the NHIF, and we have also from Kisii we're going to pick 20. We can ease the burden of the abandonment of these people in the streets and any other place.
What remains is for the relatives of these patients to avoid seeking services of the witch doctors so as to break the stigma associated with the condition and their trigger factors. Fred Moturi, KTN, Kisii.